Joining me right now with her thoughts on what she just heard, Republican Congresswoman Marsha Blackburn of Tennessee. It's good to see you, Congresswoman.
Good to see you, Trish.
Yeah. Look, there are important things that need to get done. Health care reform, tax reform.
Yes.
We just heard from the Treasury Secretary. He is committed to it, he says. But, those tweets this morning are taking people off in a different direction. Your reaction to them, are you disappointed that he tweeted those things?
I would rather him have not tweeted those. As I would tell my children many times growing up, sometimes there are things that are better left unsaid. And right now, our focus is on getting a health care bill finished. It is on tax reform. It is on broadband and infrastructure expansion. It is on an energy plan for our nation that is an all-of-the-above energy plan. Those are things which we in the House are trying to deliver on. We want the Senate to match
Congresswoman, does this threaten it? I mean, do his actions in any way make it more difficult for you to move forward with the agenda that you're looking to accomplish?
It does not. The House is moving forward with our agenda. We would like for the President to take the time tweeting about the accomplishments that we're seeing and the things we're doing for the American people to deliver on promises that were made. And I think that this is something that it allows attention and airtime to go to things that are not going to push us forward on that agenda.
So like you said, you wouldn't have done it. But there are important policy items that need to be taken care of. What are you hearing in terms of health care? I just want to point out to our viewers, the markets have recovered a little bit off the lows of the session, down still 166 points, however. And the concern here, Congresswoman, is that the Senate is not going to be able to come forward with something by tomorrow. That Friday deadline now looming, effectively 24 hours away. What are your sources within the Senate telling you about what they might be able or not be able to do?
Right, and I've talked to other members. I think the Senate is looking at adding some components that would be appealing to some of the conservatives, and then also looking at beefing up some of the provisions around the specifics that deal with opioid abuse and the crisis that we have there. We already have provisions in place, Trish, that we've passed, CARA, which deals with the opioid issues and the drug issues. We have funding that could go there, funding that could go into the state innovation grants. So the vehicles for allowing that funding already exist. And
are you disappointed at all in some of the changes, though, that the Senate has made? I mean, you think about pre-existing conditions, for example, and I do want to point out to the viewers, you see Sarah Huckabee Sanders just walking out of the room there. She had a pretty tough press conference there to deal with reporters who, basically were fed some ammunition there this morning with those tweets. But Congresswoman, in terms of the changes that were made by the Senate, what is your reaction to those?
My reaction is I want the Senate to just finish their bill and get it back to us so that we know what they're going to pass out of there. Once we have that, then we'll be able to react to whatever their final bill is. We understand that what they want to do is change some of the formulary dealing with Medicaid. They want to make the block grant proposal an option rather than something that the system gravitates to. There are things that I do think we can work with to turn us back toward patient-centered health care, which is our goal. Making certain we turn this corner and we give individuals the ability to direct their health care choices, and insurance that is going to be affordable and usable.
All right. Well, we'll see whether or not it happens. Thank you so much.
Thank you.
Marsha Blackburn, good to see you, Congresswoman.